Hello everybody and welcome to this new discussion video on asthma. In this video we will be discussing the broad topics that come under asthma. But before I get to the video proper, have a look at this. Do you recognize these two very eminent athletes? The one on the right is Kathy Freeman, Australian, Olympian and athlete. One on the left is David Beckham, needs no introduction. These two athletes have had such an inspiring journey and have been a source for motivation for so many people across the globe. But what you do need to know is that these very inspiring athletes have come out and talked about very openly their struggle with asthma. And that, I think, is a perfect segue into talking about asthma today. So let's get into it. In this video, I'd like to help introduce asthma, what exactly asthma is, what are the signs and symptoms of asthma, and how do we broadly manage asthma in the clinical setting, right? So let's get to it. Just as a basic introduction to asthma, when they took a census in 2019, they did find that there are about 262 million people who were suffering with asthma back in the day, and the number of deaths, of course, is staggering. But what we do need to remember is that it's been 3 years, and the number definitely is not decreasing with the declining air quality and the increasing air pollution, industrialization. It will definitely become difficult to control asthma unless you're well educated about it and you know everything about it. So that would be one of my objectives through this video, and hopefully you will gain something from it, right? So just to introduce, asthma is actually a chronic non-communicable disease, and by chronic I mean that it's really long term. It develops over a period of time and it increases in severity unless it is controlled well. Non-communicable as in this is a disorder, a disease that does not spread from one another, but of course needs to be controlled in its own way. Asthma is defined as the reactive narrowing of airways in response to triggers. Now, these triggers could be internal or external. The most common triggers we see are external triggers. And again, these external triggers are divided as allergic and non-allergic. Allergic triggers are in the form of dust mites, in the form of animal dander, mold, pollen. These are the most common allergic triggers that I find people they react to with asthma. But there are other non-allergic triggers like viral infections or smoke, cold air, exercise, and these are very typical types of triggers that people have that are intrinsic to that person only. In response to this inflammation that we see in the lung, there is a profound amount of mucus produced, and this mucus is basically protective. Otherwise, in normal human beings, it lines the airway lining across, but when it's pathological, it becomes too much. It is produced in abundance and more, and it starts occluding the smaller airways in our body, in the lungs, and that's when you could have a problem. That's what causes obstruction, and hence asthma is widely regarded as an obstructive lung disease. What you should understand is by reactive narrowing, I actually mean that the airway is grossly narrowed. There is narrowing of the airways in terms of the lumen and the gross diameter of the airway. And I have a picture to substantiate that. And obviously that, because of the narrowing and because of the mucus production, there is obstruction to airflow. This is a picture showing you exactly what I was talking about. This is a picture showing a cross-section of the alveolar, and it's a microscopic view. And if you really zoom in to what the bronchioles look like, this is what it normally looks like, with a layer of muscle, with a layer of cells and glands, and a normal amount of mucus. But this is an asthmatic bronchiole that is responding to a trigger, and you see here that it shows a gross narrowing. There is extra mucus production, there is a decreased lumen diameter, and there is a contracted smooth muscle. All of this eventually causes gross narrowing of the airway, leading to symptoms. So coming to the signs and symptoms of asthma. Asthma symptoms could range anywhere between a mild inconvenience to a life-threatening episode. That's how variable the disease process may be. Each of these symptoms depend typically on the amount and severity of the narrowing. In most people, asthma tends to be an episodic phenomenon where each episode is characterized by breathlessness, that is difficulty to breathe. They may experience wheezing, a typical obstructive air sound that can be appreciated, chest tightness, and cough. Usually it's a dry cough but can also be accumulated with sputum. Having said that, along with the other symptoms of asthma that we discussed, there are some typical types of asthma that people may experience. One is the aspirin-induced asthma, and this is a very, in terms of science, it's an interesting phenomenon. Of course, it is disabling. It's an asthma, but it is triggered because of aspirin. Aspirin tends to increase the amount of leukotrienes in the bodies in comparison to the prostaglandin, and that's just the pathophysiology behind it. But aspirin will then trigger asthma, and these people are generally told to avoid aspirin because of the symptoms produced by it. Another important type is the adult onset asthma. Not very common, but it's seen in the later stages of life. The patients come to their providers saying that they're having breathlessness in the later years of their life. Another is the exercise-induced asthma, and this asthma is brought on by exercise. And generally they say when you're exercising, then the quality of air going in triggers the asthma. It's not as humidified, it's colder, and it's not as processed as we do when we are normally breathing, and that's what causes exercise-induced asthma. There's a cough variant asthma, which is regarded as an asthma characterized by cough more than breathlessness. And a nocturnal asthma. Nocturnal asthma is interesting because it is grossly dependent on the circadian rhythm of our body, and the symptoms are seen predominantly in the night. And that's what nocturnal asthma is. For each of these types of asthma, since there isn't much written in literature, I will try and link up in the description if there's anything else that you may want to read up on. So going further, when you do present to your doctor and your hospitalist with these symptoms of asthma, the main modality of diagnosis for asthma is a clinical diagnosis, and primarily because the symptoms are so characteristic. But of course, to confirm a diagnosis, your doctor may ask you to get a spirometry test done. A spirometry test is a part of a pulmonary function test wherein you're asked to blow through an apparatus, and objective data is calculated based on the quality and the effort that you can use to blow in through that apparatus. There is one particular index that they use called the bronchodilator reversibility test, wherein they assess the reversibility of the narrowing of the airways in response to a bronchodilator. Right? So that's how you diagnose asthma. Coming to the management of asthma. Now, since it's a chronic disease, since it's a reversible disease, but again, it could be episodic, there are different ways of handling this depending on how severe the disease is. There has been a set of guidelines that have been released by a regulatory body called GINA, and I will link the latest update of GINA in the description. Talking about it in the video could be a little difficult to cover everything, so I thought it'd be easier if I covered the main points, but of course, for further reading, I linked it up in the description. The main goals of treatment for asthma for any patient would be as follows. The first one would be, if you're coming in with an episodic phenomenon, The first one would be to maintain remission, to make sure that this particular episode is taken care of. The second would be that you reduce the further frequency of asthma. So you make sure that there are no further episodes of asthma. You reduce the exacerbation frequency. The third would be to reduce the severity and frequency of symptoms. And say you did have episodes in future, how can we minimize these symptoms and how do we reduce the frequency of how these symptoms occur? The fourth is decrease the need of reliever medication. I will talk about reliever medication further. And the fifth one is to improve the overall quality of life. These are the 5 goals that have been given that are kept in mind when you're treating any patient with asthma. So coming to the management proper, the medical line of management involves 2 types of drugs. There will be drugs to control the episodes, to prevent future episodes. These are called controller medications. And you can have reliever medications to control breakthrough symptoms. Say you come in with an episode of asthma, I will be giving you a reliever medication to control that particular episode. Broadly, these asthmatic drugs are of different kinds. They could be anti-inflammatory drugs, they could be bronchodilator drugs. Each of these drugs has a different mechanism of action, they have a different way of working, and they are used for different purposes in different stages of the disease. So to just talk about the drugs would be insufficient, but broadly we can say that these drugs do they work in different parts of the pathophysiology to overcome different parts of the disease. Some of the drugs could be bronchodilators, like they could be beta agonists, or they could be muscarinic antagonists, and they help in overall helping the narrowing of the airway. They overcome the narrowing of the airway. Or it could be anti-inflammatory drugs like steroids that reduce the inflammation, reduce the mucus production, and overcome the narrowing. So that's how we treat them medically. Apart from the medical line of treatment, you also have various risk factors which in fact are extremely controllable. And some are not controllable, but you have to be able to identify the modifiable risk factors and control those so that you are in fair amount of control for the further episodes in future. Some of the modifiable risk factors are allergies, obesity, psychological problems, and socioeconomic problems. What's interesting is that there are a fair amount of non-pharmacological measures to be able to control asthma, which are smoking cessation, a good amount of physical aerobic activity, a healthy diet, and avoid occupational exposure. So with this, I'd like to conclude this video on asthma. It was very short and very brief. I will attach some more reading materials in the description so that you can have a broader understanding. This was just an overview of how asthma looks like, but I hope it was informative, and I hope it got you curious into getting to know this disease a little more. And yeah, that's it. Thank you very much and have a nice day.